Hello. Welcome again to the Be Well for Life series, where we're talking about ways to improve our health, enjoy better health, live longer lives, all of the good things that can come from taking better care of the wonderful bodies that God has given us. And today's topic is the mind-body connection. There's a close link which we'll be exploring between the mind, our thoughts, what we think, and the physiology in our bodies, how our body works. And of course, it goes both ways, doesn't it? By taking care of the physiology, the mind and the brain and so on, and the emotions work better too. So we're going to be exploring that concept together. And starting, let's take this thought here for just a moment. How do you define good health? You know, usually when we talk about things about health, we say, do you have health insurance? What do we mean? Well, we really mean sickness insurance, don't we? Or if they say, do you need life insurance? Well, it'd be nice to be able to guarantee your life, but we can't do that. What does it really mean? It really means death insurance, doesn't it? So we use these terms, and when we talk about good health, sometimes we just think about, heart disease and cancer and all these kinds of things. We forget the positive side, and also maybe some of the other dimensions, such as good mental health and so on. So here's some thoughts to think about. What is good health? And a term we often use when we're talking about the positive aspects of health is this term, wellness. That's the very positive concept about health. And here's some things that it might include. Being happy, certainly an important part of feeling good, being healthy. Wellness is being happy, isn't it? Being positive. You expect good things to happen in your life. You're fit. You're strong. Your blood pressure is in the healthy range, less than 120 over 80. Our cholesterol is good. We're enjoying being in a healthy weight range, and we know that that's good for our physical health. Maybe for someone, it's freedom from pain. Certainly that would be important, especially if you have a lot of pain in your life. Good health or wellness is freedom from that. And it's other things too, like enjoying frequent social interaction with others, being with friends, the interaction that takes place, and feeling rested and energetic. You see, these are all positive qualities about health and wellness that we don't normally always think about. So let's look at some things that other people have said as well. Health or wellness, by a CEO of a large corporation up in Oregon, it says is looking, feeling, and performing your best. This is in a letter he wrote me after we developed a wellness program for his staff there at his organization. And I thought it was a good definition of what wellness or health is. Looking, feeling, and performing your best. The Olympic goal is similar to that, isn't it? It says becoming the best you can be. I like that. So it's the idea of growth, and even though we don't have anything wrong, but wellness is that positive aspect where we can continue to reach higher goals and making our health the best that it can be. Abraham Lincoln throws a little statement in here that kind of puts it in perspective too. It says, health is determined by the choices you make. We've looked at a lot of those choices, haven't we? We'll be looking at some more of them today. And then the World Health Organization brings out the concept again, attaining one's highest potential. You like that? I think that's good, isn't it? So these are all very positive aspects. And of course, the Department of Health and Human Services talks about preventing disease, improving the quality of life, living a longer, more productive life. These are all things that we want to enjoy, aren't they? So that's what we talk about in health. And as we're talking about this, you can see we're moving away from just the physiology and the body and so on and how it works, but also about the mind and our thinking and our emotions, our social interaction with other people and so on. All of that is part of our health. That helps us to appreciate it when we look at their World Health Organization's definition of health that they had when they were first beginning in their charter back in 1946. They said health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So just because we're not sick doesn't mean we're well. It's also having all of these other positive things, isn't it? Physical, mental, social well-being. So I like that. I also like the way the Oxford Concise Dictionary talks about health and wellness. It says it defines health as physical, mental, and spiritual soundness. Very concise, isn't it? So that's what we're going to try to talk about today, is this wider aspect of health, bringing in the mental, the spiritual, and the social dimensions as well. There's a verse I like about that the Bible has this same concept in 1 Thessalonians 5:23, and it says, "And the very God of peace sanctify you wholly. And I pray God your whole spirit and soul and body be preserved blameless unto the coming of our Lord." So here we see this bigger dimension, don't we? This wholeness concept. Years ago, I graduated from Loma Linda University and getting my doctorate in preventive health care. And they have this motto that's in their seal. It says, "To make man whole." And I think that's a good motto, whether it's coming from health or whether it's from our mental or spiritual life or whatever it is. We want this wholeness, the whole body working together. So let's look at some of the causes of poor health. Unhealthy lifestyle is what we've been talking about a lot already, hasn't it? Smoking, sedentary living, poor eating habits, and so on. We've seen the data to show that that significantly impairs our health. We haven't talked too much about some of these others. Injury. Of course, if we're in an accident and we're injured, that certainly can result in some serious problems. Germs. Right now, we're going through a time in the COVID crisis here and the pandemic in the United States, and we're all focused on germs. That seems to be all we hear so much about right now, and certainly that's important. If we live in an environment where the viruses and so on about us are very high, we pick up these diseases and certainly causes some real serious problems. And there's certain genetic tendencies that we're born with that have an influence. And then the last one there, lack of access to health care. These are common causes of poor health. But there's a whole other host of these. If we look at this slide a little closer too, on the right-hand side, we see things like excessive stress, being unhappy, anger and hostility, loneliness and worry. These are all negative emotions, aren't they? And lack of affection, love, or acceptance. I think we would all recognize that those are serious conditions that can result in disease too. And we'll look at the scientific evidence as we get to looking at that. So optimum health then includes the concept of wholeness, mind, body, and spirit, and the community in which we live, all working together to have the best health possible. So let's take a look at some of this. Here's a little quotation I like from Ministry of Healing, page 241, and I like this quote. It shows the effect of the mind on our health. It says, "Many of the diseases from which men suffer are the result of mental depression." Well, we certainly see a lot of that today, don't we? Depression seems to be very common today, and it can have some very serious consequences. But notice these negative emotions that's brought out here. Grief, anxiety, discontent, remorse, guilt, distrust, all tend to break down the life forces and to invite decay and death. So you see these negative emotions that's in the body, if we don't correct those or deal with those, they can have a very negative effect on our overall health. And we'll look at research that shows that it will actually shorten our life and can cause many serious diseases. So that's the negative aspect. But let's look at the positive on the other hand. Another quotation from Ministry of Healing. Courage, hope, faith, sympathy, and love, what do? They promote health and prolong life. Do you like that? So these positive emotions can do just the opposite. A contented mind, a cheerful spirit, is health to the body and strength to the soul. So our state of mind, it has a big influence on the health that we enjoy, and that's what we're going to be talking about, what we can do to have better health by looking at mental health and social health as well. There's a quote from Dr. Pence, who has done a lot of writing on this topic, and he simply puts it this way: to be healthy, one must have a happy mind. It's so important. Well, there was a study done that looked at these. I guess we'll look at that in a minute, but first of all, let's just look at some of the concepts in this mind-body connection. The thoughts we think, notice there, can cause changes in our physiology, can it? Changes in our heart rate, changes in our blood pressure. If we get angry, if we get scared, the heart rate comes up. We can feel that heart beating in our chest. We become anxious, we become tense, and we begin to sweat a little bit, and that's the second one there. Our skin begins to sweat. It begins to sweat the conductance of an electrical current by a galvanometer on the skin can measure those changes taking place, and it happens very quickly. This was illustrated to me when I was in graduate school, and we were talking about stress management. They were talking about how the mind can have an effect on the physiology. So they said, we're going to do a little experiment. We have a little galvanometer here, and we'd like to hook it up to someone and ask you some questions. And on the little galvanometer, it has a little needle, and as you become more nervous or under stress, that needle will go up. And we've also hooked that galvanometer to a little horn so you can hear it. And when you relax, it has just a very calm, relaxing sound. But as you get more nervous and more uptight, that noise will get louder and it will get higher. And so the whole class could see. So he says, I want to volunteer now to hook this up. I'll ask you some questions and we'll see if we can make a stress response happen in you. So I raised my hand. I said, I'm a pretty relaxed fellow. I don't think you can say anything that's going to make me stressed out. So I put my little finger in there, and people began to hear the nice, calm, relaxing sound that it made. They knew I was doing well right then. And he asked what I had for breakfast and some things I had done that day. And then he slipped in a question I wasn't quite ready for. And he said, now, how did you do on that histology exam last week? Well, that was a really tough test. And nobody in the class got a very good score. I think I had one of the top scores, but it was only about half of them right. And so I had some hidden agenda in my mind yet still there. And the minute he said that, that little needle just pegged clear up there on the right-hand side, and that little horn went way up high, and everybody knew how I had struggled on that histology exam. So immediately, when we have these negative thinking, which I had about that exam, it makes changes take place, and in the very fingertips, the skin ability to pass a current through it, the little sweating and so on, it happened immediately. And so there's this close connection. What we think affects our physiology. In fact, there's a whole type of study now. It's called psychoneuroimmunology. It's the study of how the mind affects our immune system. And positive emotions improve our immunity, and studies have shown that the negative emotions impair the immune system, making us more susceptible to disease. So let's look at this a little more closely here. Again, just to reiterate, for optimum health, we need to have all of these dimensions working together in harmony, don't we? And that gives us the best health. There's a verse that kind of talks a little bit about that in Proverbs I like. It says, a cheerful heart is what? Good medicine. But a broken spirit saps a person's strength. I think in the old King James it talks about it makes you feel like you have dry bones. I'm not sure this is their newer translation, how it expresses that, but it saps a person's strength. It affects our bodies adversely, so that we're not in good health if we're unhappy, but if we're cheerful, it's like good medicine. Well, there was a study that shows that very clearly. That was the Alameda County study, where they asked this little question, and we've talked about this in the past just shortly. It says, how happy are you? Very happy, pretty happy, not too happy. And what we see, the results here on this chart, as we look a little closer on the right there, you'll see happiness and life satisfaction on the bottom of the graph, and then those people have low or high happiness. And looking at the yellow ones first, and the men, notice that they had low happiness. The height of that bar chart shows the rate of mortality from all causes. Actually, it's a percentage during those 9 years or so of the study, the people that died. But notice those who had high satisfaction, well, that's a big drop, isn't it? Almost cut the risk of dying in half. And look at it in women in the blue. Almost cut the risk by about 3 times. People who had low happiness, were unhappy, in other words, much higher mortality rate than those who had a happy life. So it illustrates very quickly that our mental health is just as important as our physical health in determining our overall health and wellness and longevity. There's a cute little thing from the daffodil principle, it's called, and it kind of relates to that, and we'll just look at it here. It says, don't be afraid that your life will end. Be afraid that it will never begin. There's no time better than right now to be happy. Happiness is a journey, not a destination. So work like you don't need money, love like you've never been hurt, and dance like no one is watching. Well, we need to have that spontaneity, that happy spark in our life, don't we? That's what life is really about. And that's what that little poem is kind of bringing out. Also, our relationship with other people, our social ties, have a big impact on our health. And we'll look at a few studies here. This again from the Alameda County study where they had the 7,000 people followed for 9 years, asked them many questions. One of the questions they asked about in this time was how much connection we had in social interaction with people. Were they married? Well, of course, that's one of our biggest social interactions, isn't it? Did they have little or no contact with family friends? Did they not belong or attend church regularly? Or were they not a member of any social group or club? And people would respond, and they had a little score, wellness score, or a social score. And here's what they found after 9 years of follow-up, that those who had low social ties, and we'll look at the chart here in a minute, during that 9 years, notice that they died at a higher rate from things such as heart disease, stroke, even respiratory disease, cancer, digestive system problems, all of those much higher in the group that had low social contact. So is it important that we have friends and interrelate with people? Certainly is, isn't it? Now here's the chart that actually shows, if we look at the chart here, on the left-hand side you see the mortality rate as it goes up and the relative risk there. At the bottom, the social network score, and either they had high social interaction, which meant that they had all four of those factors that we were looking at. They were married, they had frequent contact with family and so on, were members of a church or a club or other social group where they could interact. And notice how low their mortality is of those who had high social network. But notice in men, if they had a low score, 2.3 times as many of those people died during that 9-year study. Those are amazing differences, aren't they? And for women, it was almost 3 times as high. Having interaction with our friends and our families, very, very important. And so that just illustrates that concept. Here's another one. This is the Tecumseh study, where they had 3,000 men and women and looked at them for over 12 years. And they looked at their social network score, again, rated them as high or low. And look at the difference in that graph there, the one on the right, about 2 to 2.5 times higher, more likely to die from any cause. People that had low social contact and poor relationships suffered much higher mortality rates. So it shows, again, the importance. Another aspect of social health is, of course, do you feel lonely or do you feel isolated, cut off from people? I think a lot of people right now during this pandemic would say yes. I think we've all experienced that. It's had a negative impact on our overall health. But this was 17,000 healthy men and women. They followed them for 6 years, and they again gave them a social network score. And notice those people had a high social interaction and so on compared to low, a difference of about 4 times in this group of 17,000 people. 4 times the risk of mortality from any cause. So it certainly shows that we need that interaction, don't we, to have good health. Dr. Lisa Berkman studied the survival rates of people suffering a heart attack and then looked at their interaction with friends and support people in their lives and so on, and compared that to their heart attack rate in the following 6 months following their heart attack. And notice there on the chart, again, the left side showing the death rate, the higher the number there, the more people died. This is a percentage. Remember, they were already sick and had gone through a heart attack. But if they had no support, they had the highest mortality. If they had one person in their life that provided emotional and social support, notice it dropped down significantly there. And by the time they had 2 or more people in their life that was giving social support during that traumatic time of their life, notice the mortality rate was again about half or less than half. So having people that we can count on, having family members, if we get into trouble, having social support, very important for our good health and for our survival. Now we mentioned depression earlier, and I think we've all recognized that when we're depressed, we certainly don't feel good, and whatever health problems we have, it certainly makes worse. And here's a study of about 1,200 people who again had a heart attack, and they're looking at the rate of survival based on whether they were depressed or not. So looking across the bottom, you can see the first one there, the people who were seriously depressed, they had the highest mortality death rate following their heart attack when they were depressed. If they were mildly depressed, not as much. And if they were not depressed, again, a significant decrease in their mortality. It simply illustrates, again, this concept of happiness or not being depressed, how important it is to our health. And if we're very unhappy most of our time, it has a serious effect on our health and certainly our survivability. Now, let's take a look at some of those emotions, some of those negative emotions that we mentioned earlier, how they tend to rob our bodies of the good health that we would like to enjoy. So this study was done by Duke University, and they studied anger and heart disease. It was published in Circulation, a journal for cardiologists. 12,000, almost 13,000 people, and they gave them a test that they filled out that helped them to see if they had low anger, moderate anger, or high anger in their life. Now notice there, those charts, those with no anger or low anger, very low on the mortality levels, isn't it? If it went to moderate anger, there was a 35% increase in the development of heart disease over the 6-year study. And those who had a lot of anger in their life, look at that, 2.7 times more likely to have a heart attack in the next 6 years. Well, one thing that we can do in preventing heart disease, we want to keep our heart healthy, is take a look. Do we have a lot of hostility? Do we have built up negative emotions about people or things or whatever in our life? Well, it's hurting us if we do. And we need to get rid of that, don't we? And replace it with love and kindness and forgiveness and the kinds of things that help just to get over anger. How about worry? Do you ever worry about things? Well, worry is, again, one of those negative things, isn't it? We become anxious. We're worried about things. How is it going to turn out? And sometimes people can work themselves up and to be to the place where they have an anxiety attack even. So here's an interesting study. 1,700 people followed for almost 14 years, a long period of study. And again, they simply gave them an assessment and rated them on their worry. And they've got 3 groups here. The first group, across the bottom of the chart here, if you take a look at it, is seldom worried. Those who had a high worry score, and then it was interesting the way they worded it in the research articles, those who had even a higher worry score. They were the really worried people. And look at the heart attack rate over those 14 years. Now we ask ourselves, does worry affect our health? Well, it certainly does. Did all of that worry help their health? Not at all. And so we can get in a state of worry and concern and over-concern and so on, where it actually does more harm certainly than good. So let's just take a moment and think about handling worry. We ask the question, does it help to worry? Well, as far as our health is concerned, it usually doesn't, does it? Mark Twain had this statement. He says, I've had lots of worries in my life, most of which never happened. Well, I suppose we could look back and see the same thing, isn't it? We get all bent out of shape and all worried about something, and then it doesn't happen, and we've had all that negative emotion for no count. Another person said, worry is like paying a debt you don't owe. You see, even if it's not something that can harm us, we worry about it and it will cause problems. So we need this concept of learning to live one day at a time, don't we? It says, yesterday is past and can't be changed. Tomorrow is in the future. And all we can do is take good care of today, and tomorrow will take care of itself. So as we begin to develop that attitude, do what we can today, don't worry about tomorrow, and don't fuss over the things that happened yesterday. Concentrate on doing the best we can each day. Good principle, isn't it? Living one day at a time. So we find today that this worry or anxiety, it's listed as our nation's most common mental health problem. It affects more people than any other mental health thing. And that's kind of reflected because we see the large number of people who are taking medications for worry and for anxiety and so on. Very, very common. So worry is common, but it's usually not very helpful. I like this verse in Philippians 4, 6, and 7. What the Bible says about worry. It says, don't worry. About what? Anything. Instead, what? Pray about everything. In other words, if you've got a problem, instead of internalizing it and fussing and worrying over it, give it to God. Let Him worry about it. And then trust Him and let that worry go. Tell God what you need and thank Him for all He's done, and then you will experience God's peace, which exceeds anything we can understand. So what we need to do is replace worry with prayer. And when we do that, we trust our divine Savior, and He gives us peace. Well, as we mentioned earlier, sometimes people worry so much about things they have an anxiety attack. And it can be just as real as any other serious health problem that a person experiences. And so here's what can happen. If we worry and get too anxious about things, we can experience weakness, shortness of breath. It feels like maybe we're not getting enough oxygen. The heart rate will beat rapidly. These are all signs of stress, by the way. We become nauseated in our stomach. Our stomach can get upset. We don't digest food well. We can have hot flashes, dizziness. We feel like our life is out of control. And sometimes people get so upset that it's like they think they're having a heart attack or something because it's similar symptoms. So beware of that concept of an anxiety attack. And of course, we need to catch that early so we can prevent it. So what can we do? Well, here's some suggestions that's recommended from the Mayo Clinic. It says try to identify trigger situations. What is it that leads us to an anxiety attack? Sometimes people are very afraid of certain things, and that's a trigger for them. And so when we feel that coming on, what can we do? Well, they suggest call a friend when you feel an attack coming on. Again, it's that social support. Anytime you share a problem, they help put you in perspective and talk you through some of these things, can help you deal with that better. So we need to be careful to avoid those trigger situations when possible. If you have an anxiety when you're looking way up high and you're looking down and it's a long ways down, we can avoid those situations, can we? Don't have to put ourselves in those kind of situations. Or if we feel it on, one of the best things you can do is go for a walk. Exercise as we get the blood stirring and we use up some of those stress hormones a little bit. It's one of the best things we can do to help curb that anxiety attack. But if it's something that bothers you a lot, you should get help from a mental health counselor or talk to your doctor about it. There's therapy and medications that can help relieve those situations so we can have a little more balanced, healthier life. Let's take a little quicker look at depression. What are some of the symptoms? We've probably all felt these at some time in our life. Feeling sad or empty, a loss of interest in our favorite activities. We just can't find anything that's fun anymore. Some people overeat. Some people quit eating. Seems to affect the appetite one way or another. Some people are not able to sleep. Others sleep too much. They just stay in bed. They don't want to get up and face the world. Feeling very tired. Feeling hopeless and irritable, anxious, sometimes guilty. And then there may be even a variety of aches and pains, headaches and cramps and digestive problems. A lot of people who come to the doctor for these problems, really it's depression that is the underlying problem, but they have these physical symptoms. And of course, in the extreme are thoughts of death or suicide. Sometimes the depression becomes so great, the problems seem like insurmountable, and death may seem like a good way out. That's when we need help. We need help from someone to help us to deal with that. And here's a couple of screening questions that the American Medical Association recommends for all doctors ask their patients because it's so common. Just a couple of quick questions can help identify if depression happens to be part of the problem that they're going through. So look at these questions and you can answer them in your mind. It says, during the past month, have you often been bothered by feeling down, depressed, or hopeless? Okay? And if you do, that's not a good sign, is it? Number 2, have you been bothered, often bothered, by having little interest or pleasure in doing things? Nothing just seems fun anymore. If you answered yes to one or both of these, it recommends that you may have a problem with depression and you may need to do a further evaluation or talk to the doctor or someone to help. A friend of mine is a psychiatrist who deals with this mental health issues all the time. And I asked him one time, I said, well, how do you diagnose if a person is depressed or not? He says, well, that's easy. I just ask him, do you feel depressed? And he says, if they do, then we deal with it. And so if you've been feeling down and these kinds of things, don't ignore it. Get some help because it is treatable, isn't it? Talk to a mental health counselor. Ask your doctor for help. There's medications that can help correct this chemical imbalance that actually begins to occur in the brain. And there's talk therapy. Mental health counselors can help you deal with some of the issues you're dealing with. But how about if you're living with someone who's depressed? What can you do to help them? I thought this was good from Mayo Clinic again. Here's what you can do to help someone that maybe that you're living with who's depressed, to help them to get care, because that's what they really need, isn't it? It says talk to the person about what you've noticed and why you're concerned, and explain that depression is a medical condition. It's not just something because we got in a bad mood or something. There's actually changes that begin to take place in our brain, changes that can be helped by treatments. Suggesting getting help from a professional, their doctor, a mental health provider, licensed counselor or psychologist, someone that's trained to deal with depression. And offer to help, even prepare a list of questions to discuss with a doctor if you go to see them, or a mental health provider. Just gets them, you see, ready, tries to remove some of the roadblocks. And then even express your willingness to help by setting up an appointment. Call the doctor for them. So I'll go along with you and help you. And that's what it really takes. Sometimes we just need a friend that can take us by the hand and help us to go and get the help that we need. Because the person who's depressed, they probably won't be doing it on their own. And so we need to help people during that time. Now, let's look at some of the positive emotions. We've been looking at some of the negative ones and some of the bad effects on our health. But if we're happy and optimistic in things, does that make a difference in our health too? And let's look at some research that deals with this. Here's a very interesting study of 839 people who took the MMPI personality assessment to test whether they were an optimist or a pessimist. You know what an optimist is. An optimist is always looking at the good things that's going to happen and feel like positive about the future and so on. Someone say that an optimist looks at a glass that's half full and he says that's half full. But a pessimist looks at the same glass and he says, no, it's half empty. So you see the difference, where we put the emphasis in our life. And so if we're looking at this chart, first of all, they took the test, they put them in one of these two categories, optimist or pessimist, and then they simply waited for 30 years and then looked at mortality rates between these two groups of people. Interesting study, isn't it? 30 years later, here's what we found in the graph. Notice on the left, the optimists have the lowest mortality. The pessimists were significantly increased. In fact, they found for every 10 points increase in pessimism on this test that they took, mortality increased by 19%. Those are big changes, aren't they? And how about the people that are kind of halfway between? Well, their mortality was halfway between, wasn't it? So is it important to be positive and try to look on the bright side of things? It certainly makes a difference if we want to live a longer, fuller life, doesn't it? Another very interesting about optimism and cardiovascular disease. So many of our emotions affect the heart. You know, as we get upset or whatever, we can even feel it in our heart and sometimes in our stomach, can't we? These changes that take place. But this study was a very large study, 229,000 people. Again, for about 14 years, they followed them up. And again, they simply took this test that tells them if they were low on the optimism or high on the optimism score. And you can see there on the right, those who had a high optimism score, significantly less, 35% lower risk of cardiovascular disease, and a 14% lower risk of dying from any cause. So it's important, isn't it? By trying to be cheerful and optimistic and looking on the bright side of things, it has a big effect on our health. And one more study, a large study, this was done by Harvard, 70,000 women over a 10-year period. And if you look closely at the chart here, you'll notice the blue and the red. The blue are those who have the low optimism scores, and the red are those who are the optimists, have high optimism score. And they just looked at different diseases over a period of 10 years. Who developed heart disease, who developed a stroke, and so on. And notice those significant differences between the heights of those bar charts. Most of those are 30 or almost 40% lower, aren't they? And you can see the list there. 38% fewer heart disease deaths and 39% fewer strokes and so on. Notice infections even. cut the risk of infection by half. Even cancer, 16% lower mortality from cancer. If you want to prevent cancer, what can you do? Well, we can have a more optimistic outlook on life, more positiveness, isn't it? And a 29% fewer deaths overall. It's amazing to see how important these mind-body connections are. And if we want good health, being optimistic, a positive outlook on life, a hopeful outlook can make a big difference. Here was one done on optimism and healthy aging. Again, was done by Harvard. Over 71,000 persons, and followed it up for as long as 30 people in some people's lives. And they were all tested, and then they looked at the findings. And here what they found, that those who were optimistic had 11 to 15% longer lifespan. Isn't that interesting? So it's not just what we eat, or whether we smoke or not, or whether we exercise, those are all important, but it's also, are we thinking about being more hopeful, optimistic, looking forward in life can make a positive difference too. And they also had, notice there, a 50 to 70% greater odds of reaching the age of 85. Well, if you want a longer life, being optimistic and a positive outlook on life can make a difference. I have a friend whose name is Evan. He has 2 children. And he shared this with me the other day, and I thought, well, that was a good example of optimism and positive affirmations and helping his young boy to be more optimistic. And so every day when he goes to school, he has this little affirmation that he goes over with his son. And they repeat it together. And it says, today is going to be a great day. That'd be a good one for all of us, isn't it? When we get up in the morning, are we going to say, oh, another bad day, it's cloudy outside, it's going to rain, I don't feel good, I think I'll go back to bed. That's one approach, isn't it? And another one, he gets up and he smiles and he's happy and he says, today is going to be a great day. You see the difference there? And it makes a difference in our physiology and what we get done that day. And he says, I'm in control of my mind and body. It's me. It's not someone else controlling my life. I'm in control. That's one of the positive aspects about this. And he says, I feel happy inside. I'm so thankful for my teacher. And sometimes kids fuss about their teachers, isn't there? But the teacher's there to help them to have a better life. So I'm so thankful about my teacher. And then the last one was, good things are going to happen to me today. And that's the optimistic outlook, isn't it? So we need to have some positive affirmations every day. Starting out in the morning is a good time. And as a little assignment, you might like to write down some that you'd like to practice in the following week. So just a little definition again so we understand a little better about optimism. Good things will happen. You see, we're looking forward to good things in the future. The future will be favorable because we can control important outcomes. We don't feel like I've lost control or whatever, but I'm in charge of my life. I'm going to make sure that good things happen. And optimism, when we do that, as we just looked at, has that potential for extending the human lifespan. Optimism also helps you to regulate your emotions and your behaviors better. If we're positive and looking forward to things and we have hope, we simply, all of our life goes better. We also find that it helps us to bounce back from stressors and difficult situations. Even though we have problems in our life, if we tend to have that positive outlook, we're not so affected negatively by it and helps us to deal with it better. So it helps us to be more resilient and age better and to have a longer, healthier life. Well, here's some text from the Bible I thought you might like to look at. You might jot down these verses. And these are positive affirmations to help us to be more optimistic. First one says in Romans, we know that in all things God works for the good of those who love Him. Isn't that a beautiful thought? And if we can just keep that in our mind, no matter what happens, don't worry about it. God will bring something good out of it. We can trust Him. And then how about the one in Philippians 4:13? I can do all things through Him who strengthens me. You see, that's a very positive affirmation, isn't it? It may look impossible for us, but we say, but with God's help, we'll be able to deal with this. We can handle it. We can accomplish it. And then the last one just simply helps us to see that God is on our side. And in Jeremiah, I know the thoughts that I have towards you, says the Lord, thoughts of peace and not of evil, to give you a future and a hope. That's what God wants us to have. He wants us to have a good future. He wants us to have hope. And He can help us in achieving that. So maybe you'd like to go through the Bible and find some other affirmations and read these. And if we do this every day, it helps us to move from the negative aspect and more towards a positive aspect in our life, to be more optimistic. Now, we said earlier that this mind-body connectivity or relationship is a two-way connection. And we've been talking about how the mind affects the physiology in our bodies. How about the other way around? Are there physical habits and things that we do that negatively affect our mind and our emotional health? Well, there certainly are, aren't they? And let's look at some of these studies. There's a test that's called the General Well-Being Test that is used often to help people to see how they're just coping mentally, emotionally with life. And they found in this large study in Canada that people who were physically active scored much higher on this mental health test. In other words, the exercise itself, which improves the circulation and the blood to the brain, and help us to feel better. And we've had studies to show now that people who exercise, there's actually different chemicals and things that change in the brain and endorphins and so on. They give us a natural high to feel good and happy. And they found that people who exercised more did better on this mental health score. So let's take a look at the actual chart here. Here's the results. Men on the left, if we look at the chart. And those little numbers at the bottom of the chart are the number of miles they walked or jogged during that week. And notice that every time there was an increase in their exercise level, what happened to their mental well-being scores on the left-hand side? They went up, didn't they? Showing that they were dealing better with life. They were happier. Life was positive and good for them. And notice on women, even a bigger difference, doesn't it? The women who didn't get any exercise scored much lower, but even if they just got 1 to 9 miles a week, a significant improvement in their mental health and well-being, and the more exercise they did, the more positive their scores. I've repeated that test with a lot of corporations that I work with. We've worked with many hundreds of corporations over the years. We find the same trend almost every time when we do a corporate analysis on the company. Those who are more physically fit and get more exercise always score better in their life satisfaction and in their mental health. Well, here was a large study of over 5,000 people, almost 6,000, who was going to test their mental acuity, how the brain works. And then they compared that to how much exercise they got. And looking at the chart here, it says, notice, people who walked the least, less than half a mile a day, had the most mental decline over the time of this study. They gave them a mental acuity test at the beginning and then several years later at the end, and then just looked at how much exercise they got. And those who tended to be more sedentary, what happened to their mental ability? Went downhill. Not good news, is it? But people who walked the most, and in this study, 18 miles per week, that's quite a little bit, isn't it? They had the least mental decline. In other words, they had the best mental acuity pre and post test. Well, if you divide 18 by 7, what does that come out? Well, about 2.5 miles per day. And that's my goal right now, 2.5 miles per day. And as you do that, not only does it help you to feel better and your heart to be stronger and so on, but it helps you to have better mental health, to think more clearly, and your brain simply functions better. So you see there's this dual relationship. How we think affects the body, and how we take care of the body affects the brain. It goes both ways, doesn't it? So that the chance of mental decline, they also found, decreased by 13% for every extra mile walked per week. Isn't that something? So a positive thing you can do to keep that brain healthy and functioning well. And they summarized the study. It says exercise, such as walking, is one of the best ways to preserve your mental ability. Good to know, isn't it? Also, they found that strength training has a positive effect on the brain and the mental ability. And here they took a whole bunch of studies, randomized controlled trials, 33 of them, about 1,000 participants, and 930 controls. And the experimental group, of course, were doing strength training exercises, weightlifting, and those kinds of things, and the controls didn't. And then they compared the difference in how it affected the brain and the mood. And notice there on the right, it says strength training significantly reduced depressive symptoms. Things like low mood, loss of interest in activities, feeling worthless. So again, if you want to prevent depression, you want to feel good, you want to have good mental health, even doing strength training can have a very positive effect on the brain. We've probably all heard of Alzheimer's, dementia. Not something that's very pleasant, is it? We probably all had family members or friends who experienced this. And it's real sad to see how the brain deteriorates over time, and people will actually die from that. In fact, it's one of the top leading 10 causes of death in the United States right now, and it's growing because we have a growing aging population, and more people die from Alzheimer's disease now than even from diabetes. So it's a big problem. But this study, they took 716 older persons. None of them had Alzheimer's disease at the start of the study. And they measured their activity level using an accelerometer, something they can wear on their body. I don't have mine on right now. I usually have a watch that has one built in. And you can see how active you are. Then they followed these people for 4 years and looked at their activity level to see who developed Alzheimer's disease and those who didn't. And that's what you see in this chart here. Notice the difference in the risk of developing Alzheimer's disease by the heights of those bars from those on the left with low activity compared to those who had high activity. What do you see there? Over a 50% decrease in likelihood of developing Alzheimer's. So you see this relationship again. If you want your brain to work well, want it to have good mental abilities and so on, what can we do? Physical activity that stimulates our breathing and our blood flow and the exercise not only is good for the body, but helps the brain. Well, how about foods we eat? Does that make a difference? Well, this was a good study. It was in the Journal of Psychosomatic Research, the effects of the body on the brain. And they looked at what people ate. Nearly over 9,000 people. They all took a diet history. And then they also took a psychological inventory. And did they feel good? Were they happy? Were they had positive emotions, negative emotions? And they measured that. And then they compared that with the foods that they were eating. And here's what they found. Foods linked to better mental health were things like vegetables and fruits. Now, you've heard me talk about that. And keeping the heart healthy and preventing diabetes and keeping the weight down and so on. They're loaded with all kinds of good things for our body. And, of course, our brain cells need those too, don't they? All those good nutrients and phytochemicals and antioxidants, very important for the brain. Notice olive oil, too. Those who had a higher intake of olive oil had better mental health. You know, the brain needs to have healthy fats. And olive oil is a healthy fat and actually helps the brain to be healthier. Those who had a higher intake of legumes, beans, peas, lentils, garbanzos, those kinds of foods. High in fiber and healthy plant protein. And then nuts, another good example of a healthy plant protein, but also high in those healthy fats, the polyunsaturates and even the omega-3 fatty acids. All of those are good for the body and good for the brain. And notice those who ate those foods had better mental health. They were happier. The brain worked better. Now, notice that list of foods that was linked to poorer mental health. Sweets and desserts, lots of sugars. Not very good for the brain. All the soft drinks, all the fast foods, which are many processed foods and raises the blood glucose levels, and a lot of them are high in cholesterol and saturated fats. And then, of course, the last category, red meats, again, very high in the saturated fats. People who ate a lot of those foods, they had poorer mental health. The brain didn't work as well, they weren't as happy, and they couldn't think as well. So you see, we need to take care of the body, we need to take care of the brain. So here's some positive mental exercises. If we just want to have better mental health, here's some things to think about that can help us to have better mental health. Practice gratitude. What are you thankful for? It's a good idea for people who are sometimes having problems with mental health, every day just to sit down at the end of the day, or maybe at the beginning of the day, and write down some things. What am I grateful for? And we can begin to make a list, and as we begin to look down through there, we can begin to say, well, you know, life is not quite so bad as I thought maybe. There's a lot of things I can be thankful for. Try this one, forgiving someone. Not only help that person, but it certainly helps us, doesn't it? Or simply just smiling at someone, going out of your way to show that you're happy and you appreciate them and giving them a positive smile. Doing something to help someone. Again, it helps that person and it helps ourselves, doesn't it? Practice giving a compliment. You know, people do nice things for us, and it's nice to let them know. Maybe call them up and tell them thank you, or maybe you send them a thank you note. It's a positive way, isn't it? And again, it helps both the receiver and the sender to have better mental health. And then the last one there is simply pray for someone. Be concerned for other people and put them on your prayer list and let them know that you're praying for them. Good things to help us to have better health as we focus on the needs of helping others more than just our own problems. Now, another big area of the physiology and how it affects the brain negatively are dependencies. We won't take too much time here on this, but we want to just touch on them a little bit. You know, what is a dependency? Well, it's a learned behavior that often takes control of our life and also has negative effects on one's health. So it usually is related to something that is very pleasurable or makes you feel good, alcohol, drugs, those kinds of things. And then we can become dependent on them so we can't live without those chemical aspects in our body. But it's a major effect on our health, isn't it? Nicotine is one of the more common dependencies that a person develops. Use when a person first begins to smoke, it's not very pleasurable. But after a while, the brain gets used to that nicotine, and pretty soon it craves it and wants more and more, and people become dependent. It's one of the most strong addictions. Some people say it's even stronger than some of the drugs that people get addicted to. But notice, smoking kills 480,000 people yearly. And you can see on the right-hand side there of that chart, strokes 2 to 3 times as high, heart disease 2 to 4 times as high, lung cancer 5 to 15 times higher. You can see on down through there. Very, very detrimental to our health. And the only reason people continue is because of that addiction, isn't it? And it helps them to feel better. So we have to be careful that we don't get addicted to those. The best approach, of course, to prevent it is to never start smoking. Certainly work with your children and your friends and grandkids and so on to help encourage that. But the good news is that a lot of people have stopped, haven't they? More than 50 million Americans have quit. We actually have more people now who stop smoking that are continue to smoke. So that's positive, isn't it? Something that we can do. We can stop, and whenever we stop, wherever it is in our life, our risk for heart attacks and cancer and lung disease and so on drops dramatically, especially in those first few years. And if you need help, talk to your doctor or someone to help you. There are medications they can give that makes it easier to stop, places where they can recommend where you can go to join a group or whatever. But stopping can make a big difference. And just a thought or two about alcohol. You know, alcohol says it's our most serious addictive substance in the United States simply because so many people use it. And it's like so many other things, it may start at a low level, but pretty soon people become dependent on it, and pretty soon they can't face life unless they have the alcohol. So notice that about 1 in every 16 adults today suffers from alcohol abuse or dependency. How many of those people, when they started drinking, do you think said, I'm going to develop an alcohol dependency? I don't think any of them. But it creeps up on people. And that's a pretty high ratio, isn't it? 1 out of 16. Pretty soon it becomes they depended on it, and it can destroy their health physically and emotionally, cause a lot of problems. You can see down there, 1/3 of all traffic fatalities in the United States that we see a result of drinking and driving. A serious problem. Alcoholism is one of the 4 leading lifestyle-related causes of chronic disease. And it's a big problem. This slide shows about 88,000 people a year die from use of alcohol. And you can see there from cancers, from even heart disease. Sometimes we hear that alcohol is good for the heart. Well, if you had just a small amount, it may have some slight benefits. But if you drink a large amount, it's very detrimental to the heart as well as to the brain and other things. It increases the risk for respiratory diseases and accidents and drownings and suicides, and more likely to fall and get injured. And as we mentioned earlier, automobile deaths. 45% of all automobile deaths comes from drinking and driving. And homicides. So we can see there's a whole host of things, isn't there? And you know, there's new research coming out. One I just reviewed today and slipped this slide in because it's very new data coming out. It was done, a study of over 195 countries, and they looked at the effects of alcohol on the health. And here's just a few statements that I took from their findings of this that came out in the Lancet International Medical Journal. It was the study of alcohol use and burden of disease in these 195 countries. So here's one statement. It says, no level of alcohol consumption improves health. So this idea that it makes you healthier. It may make a slight difference on one or two little things, but there's so many other adverse effects that overall your health will not be improved. That was their conclusion. It says the level of consumption that minimizes an individual's risk is how many grams? 0 grams of ethanol, the fancy name for alcohol. In other words, 0 amount to keep our risk as low as we can. And then they say again, there is no safe level of alcohol consumption. And then the last one says alcohol use, they found in their study, was the 7th leading risk factor for both deaths and disability adjusted life years. In other words, life years lost from disability because of drinking. So it's a major concern, and because of these studies, and there's some other large ones that have come out now, countries are beginning to reevaluate what their recommendation has been. Our recommendation in the United States is it's okay to drink moderately, just don't drink too much. Well, your risk is certainly lower, but the new data and research is saying we'd be better off without any. Now, when we're trying to make these kinds of changes in our life, just a thought here, it's often, if we take a positive approach towards these problems, it helps us to overcome them better. It's the concept of crowd out what you don't want with something good that you do want. One company I was working with a program in helping people to stop smoking, and I asked them what they would like to do. And we try to get their input on kinds of things. And they said, well, we think we ought to exercise. Smoking's not good for us, and I'm not sure I can quit right away, but if I start on doing something positive, I'll exercise, maybe that'd be a good place to start in my health program. So I said, well, great, let's get on an exercise program. And what I found is that they exercised limit up, and they got interested in that, and they were out doing things for their body. Pretty soon they said, we don't think we ought to smoke anymore, it's not good for us. And they would stop smoking. So sometimes just emphasizing the positive, the good things, takes us to that next step where we're willing to give up something that's not so good for us. This was the Safeway Corporation we were working with up in the Northwest. It was a bread baking plant. They make all the bread for the West Coast, even clear up to Alaska. And it was fun to work with that company. I worked with them for nearly 20 years, and we completely eliminated smoking. When I went there, 30% of the employees were smoking when we started there, and when we finished, they had 0 smokers in their company. So it's fun to see people really become excited about good living, and that was one of the things that took place. It's kind of consistent with that verse in Romans 12:21 too. It says, do not be overcome with evil, but overcome evil with what? With good, you see. So try to replace something that's difficult in your life with something better. Makes it a more successful way to make that change. And of course, if you're trying to deal with some of these issues that are very difficult, it's always good to get professional help and talk to your doctor and mental health counselors, maybe join a support group that can help you in making those changes. Now, the last aspect we haven't talked about yet is the spiritual wholeness. Remember, we said that health is physical, mental, and spiritual soundness. It was one of the definitions we had from that concise dictionary. And spiritual wholeness can make a difference in our health as well. A spiritual life, here's some of the things that it can do. It can provide us hope. It can provide peace, as we've read some of these verses even. It can give us direction in our life, just can't it? And give us meaning and fulfillment. Well, it's hard to measure those kinds of things, but it's things that we can experience, and it's what makes life worth living for us, doesn't it? So here's a couple of studies that show how developing the spiritual dimension can help us to have better health too. This was a study published in the Journal of Public Health, and they looked at over 2,000 people who were aged 55 and older. They asked them many questions about their lifestyle and so on, and then waited again for several years to see, 5 years study, to see what was those indicators of a longer, healthier life, lower mortality rates. And here's what they found. It says the most significant factor predicting who was still alive after 5 years in this study was attending religious services. Isn't that interesting? And as we make that a value in our life and practice that, it has many other effects in our life too, helping us to live healthier, cleaner lives that have a difference in our life expectancy. Here was another study from the Journal of Gerontology where they looked at nearly 4,000 older adults for over 6 years, and they particularly looked at church attendance to see if it had an effect on mortality. And they simply asked the question, do you attend church regularly? Yes or no? A simple question, isn't it? And then several years later, they looked at mortality rates between those who said no and those who said yes. And notice those who said yes, they do attend church regularly, there was nearly a 30% decrease in mortality. And that was even after controlling for health habits, age, their education level, any medical problems they had. They held constant for those. There's something about worshiping regularly with people of like faith that can bring a joy and a wholeness to their health, spiritual dimension, that has a positive effect on the physiology of our bodies. One more, this is from a special journal, medical journal that deals with prevention a lot. This was done by Vanderbilt University and UCLA School of Medicine, and they studied about 5,000 people for over 14 years, and they found that people who attended church once or more a week had a 55% lower risk of dying compared to non-church goers. Well, you can see the chart there. It's a huge difference, isn't it? Which of those groups do you want to be in? Well, as we develop the spiritual dimension and appreciate that as a value in our life, participate in that, it has a positive effect on our life. And again, they controlled for age and sex and race and alcohol intake and smoking and education levels and social support and eating habits, exercise, all of these different things. And even in spite of all of that, still showed a major drop. So developing a spiritual dimension in our life is very important to help have good health overall, that wholeness. So they listed some of the things, the spiritual values, how it may improve our longevity. It says people who develop that spiritual dimension, it helps them to reduce stress. They don't worry so much. We can turn that stress over to God to worry for us, can't we? Help develop better coping skills. It fosters compassion and altruism, unselfishness, helping other people has a positive effect on our own life. It helps to instill love and joy and peace and hope and fulfillment. See, these are all positive qualities, aren't they? They can help us to have better health overall. Giving meaning and purpose, as we talked about before. Inspires commitment to something greater than ourselves. We can be part of that. It's an interconnectedness to other people and gives us personal support and acceptance, and promotes this sense of wholeness and genders this greater personal relationship that we give as we connect to a higher power. Even the Alcoholics Anonymous group have always suggested that if they need help in making the changes, getting off of alcohol, recognizing there's a higher power and to call on that power for help. All of that helps us to live a healthier life. So just to summarize, we're talking about this mind-body connections, some of the things that helps us to have better health. We need to be active, don't we? It's good for the brain. We need to eat well. It's good for the body and the brain. We need to get our rest. We need to be social, to interact with other people. We need to avoid those things that are harmful, such as alcohol and the smoking. We need to be grateful. We need to share love with others. We need to forgive ourselves as well as forgiving others, and learn to fellowship and worship with those of similar faith and be happy. All of these things we don't normally think of as ingredients for a healthy life, are they? But they are. And I think as you've seen the research today, very important, our mental outlook that we have to enjoy a full life and to enjoy the best health that we can. Thank you.